asked if it's being recorded. And oh, hello. We're so excited to talk about endometriosis today. Dr. Kara, Dr. Hillary over here from Cultivate Fertility, and we like to talk about anything anti-aging and longevity because this is the work we do when women are trying to get pregnant and we're trying to rejuvenate their eggs and their egg quality and their whole bodies to get ready for a really healthy pregnancy. So how you doing, Hill?
I'm good. I'm excited. You were just saying that you just listened to you got a lot of new info.
I know. I could spend, every day listening to information on endometriosis because it's so incredibly interesting to me. When I was diagnosed, I was 20, so this was a long, almost 30 years ago, I'll say. And I was in severe pain, and that's what had me end up going to get the diagnosis. And of course, I'd never heard of endometriosis before. And back then, it was very much said to women, oh, get pregnant and that will solve it. But I was 20, so the doctor was telling, the doctor was a good doctor when I finally got the diagnosis. And it was sort of like, okay, we'll do a surgery, we'll remove it, we'll hope that it doesn't grow
Is that
back.
severe at the time of diagnosis? You already needed a surgery?
Oh, absolutely. Okay, so I'm going to back up and just tell you, I had a really interesting experience because I had, first of all, the telltale sign, which is extreme pain. Pain is the hallmark of endometriosis. So if you're a woman listening to this and you have really painful periods, or you have lower back pain, pain going down your legs, lower abdominal pain, pain after you urinate, pain after you have sex, all kinds of pain, then endometriosis might be the actual root cause of it. And so I had such terrible period pains that, of course, in high school, they just put you on the pill. That's what happened. It was like, put on the pill. And those were the days that we didn't in any way inform women that the pill might have side effects. So for me, I also have that.
Women are not being informed about pill side effects.
Well, but
No.
women we interact with are, like
I mean,
go-getters, and they kind of figure it out, right?
TikTok. People are getting it on TikTok and stuff,
Right,
but people are not being,
I know.
given all the info. Anyway, go
I
ahead.
know. So one of the unfortunate things for me and many other women that we work with, Hillary, is that I have genetic variations that lots of people in the population do, where folate is an issue for me and folic acid. And so the pill just depleted that even worse for me. And I felt awful taking the pill. So that MTHFR gene thing is a real thing sometimes with the pill. Anyway, a lot of people have side effects of the pill and they can't really take it. And I was just one of those people. And come to find out later on when we did those genetic tests, which we'll do another show on, we know exactly why, because of the estrogen detox pathways I have. But anyway, endometriosis at that time, we didn't have a cause because, of course, I was trying to figure out the cause. We really didn't have a cause. But I knew there was something wrong with my immune system. And one of the big theories at that time was that what it is tissue from inside the lining of your uterus, your endometrium. So that thing that allows implantation and an embryo to grow, like that lining, the thing you shed every month when you bleed, that lining is growing elsewhere. So for me, I had the unfortunate occurrence where it was growing in my ovary. So if it's growing like sitting on some of your bowel or sitting in like behind your uterus in the cul-de-sac or sitting elsewhere, you don't know about it as much. But if it's stuck inside your ovary, it just bleeds into itself and gets swollen and swollen and swollen every month. When you bleed, it's bleeding and you're capturing that blood, but it has nowhere to go because it's a cyst. So that is a really painful condition. And my ovary was just like totally blown up and all scarred and horrible once they actually got in there. But of course, my doctor had no idea why I was in pain and sent me for an ultrasound of my gallbladder. So they thought I had gallstones. Is it rare for a 20-year-old to have gallstones? I mean, I don't
think, I don't see that very much.
Right. Because it was just such severe pain.
Especially thin women, like you were obviously teeny tiny and
oh, so
it's one thing if kids have had type 2 diabetes since they were really little or they're obese, they might be more at risk. But anyway,
it was getting progressively worse, this period pain, where I would be taken out day 1 and 2 of my period, where I would just be like laying there in so much pain and taking so much Advil and taking so much, magnesium. I was taking so much stuff just to try and get me through. And I was in severe pain. And Then I ended up sort of throwing up from the pain. I remember sitting on the floor of the bathroom with my dog, who was this huge Rottweiler, and I had my arm around the dog, and I was just like vomiting, and he was sitting with me, and I was kind of like laying on the ground in the bathroom. And finally, it was like, I need to go to the doctor. Anyway, that's what endometriosis looks like when it's gone badly. And so I definitely needed a surgery. The pain degree was insane. And my ovary was really, really getting damaged and completely stuck in scar tissue when I went there. But anyway, the reason I'm telling you this story is because I think a lot of women have that kind of a symptom and they think, oh, I just have bad periods, but we're not supposed to have that. That's not normal. So that's the first point of this is endometriosis goes undiagnosed in so many people. And we just did the whole talk on PCOS. It just struck me, the statistics are almost the same. It's like probably 1 in 10 women have endometriosis also.
Yeah, I mean, and it's a really tough one because it's really diagnosed by clinical picture and then with imaging or surgery, like exploratory surgery. It's a lot of the OBs,
Mhm.
they're not these women are just getting missed. And
Yes.
I'm going to say sometimes it's really interesting because sometimes what looks like a PCOS woman is she actually has endometriosis because PCOS, some of those women can have ovarian cysts, so those can be pretty painful and stabby.
Mhm.
And it's actually making me think of a patient right now who I thought had PCOS, but her androgens were totally normal. So now I'm thinking, wow, I mean, that could really be, she doesn't have that hallmark pain but she has IBS. And so it's like, wait,
That's
maybe the IBS is
yeah.
actually, so thank you.
Very common, an IBS diagnosis or GI symptoms is what the woman is presenting with because the inflammation is so dramatic with endometriosis that you can get too much prostaglandins that can cause diarrhea, loose stool. Then you can have the other side where you have too much estrogen and it's really giving you constipation. So you can have all kinds of GI presentations with the endometriosis. But what's really interesting is that back then, the prevailing theory on it was this retrograde menstruation thing, which is where, menstrual blood will come out your fallopian tubes and somehow establish other places. But that's been dispelled at this point. So now we know, back to embryology class, Hill, when we had these like 3 layers of cells and they're folding and all this stuff, that around 6 to 7 weeks gestation. So women trying to get pregnant, this is like, very early in your pregnancy,
Very
this
early.
thing could have developed if it's a girl baby or a boy baby as the cells were folding because as these embryologic cells fold, they kind of leave a trace of what could turn into the ovaries and the uterine tissue. And it can be anywhere. It can be on bowel. It could be up in your lungs. It can be anywhere in your body. And so that's really, you're born with it. So I just want to like scream that from the rooftops. You didn't do anything wrong. You were born with it. And I think it's been striking to see with women, our fertility patients, Hill, you know how it comes back sometimes on the report when they go in and do the endometrial biopsy, and all of a sudden it says, oh, this is consistent with endometriosis, what this person has. And the person's like, I never knew I had endometriosis. I'm like, well, you were on the pill for like 15 years before trying to get pregnant, and we just suppressed the symptoms a bit. But anyway, that's just a crazy thing to recognize that you're actually born with it. And then when you start getting your period is when you start really getting symptoms. But that's why men can have it too. Because I mean, how's a man supposed to have endometrial tissue flying around his body? It's not going to happen, right? You're born with it. So that's a really big point.
Wow.
And then the other thing is that tissue, I thought you'd find this really interesting. That tissue is really interesting tissue, but there's aromatase in there, Hill, which is like too much to explain right now, but it makes its own estrogen.
Right.
So, like, wowzers,
Wowzers.
that's crazy. So all this tissue makes its own estrogen. So then you have the whole, like, pathway that we talk about. And then when they try and remove it, like, very rare that they get every little cell, so it's often that women have more than one surgery for this. I definitely had two, because it does tend to come back. And some of the hormone treatments that were offered, certainly at the time when I was doing it, was just like an absolute no. And so it's an interesting disease. And women with, endometriosis don't know that it's this like invasive disease. It's like a cancer. It grows blood supply. It does all this stuff just like a cancer kind of would. So it's really important to know if you have this. And like you said, the diagnosis, sometimes people have really awesome ultrasounds. Like I've been to specialists for endometriosis where they have really good ultrasounds and they can see and kind of like base it with palpation, like, okay, there's something here, there's an adhesion here, they can sort of figure it out, but you really need to see it to like find it, and it's like these kind of black specks that are going to be kind of like blood, sort of old blood kind of tissue all around. It can be anywhere when they open a woman up, but it turns into quite a big thing as far as inflammation pathways and everything in life. These women have more pain. Their response to pain is heightened, and we have that research. So it's a whole crazy issue that no one is really talking about for
Do
these people.
you think most women get diagnosed, obviously, if they get missed as a teenager,
Yeah.
because they get put on the pill, and the pill, I'm assuming that the pill on some level is therapeutic because it's keeping the level, really hormone level, stable. I mean, it's
Well,
like PCOS, like the pill on some level is therapeutic. It's keeping the androgen level down. And so long term, it is it's hard to argue that it has a positive impact. It's not the only thing, and you're missing things if that's the only thing you do.
but
But what
it but
about
I don't think when they started using the pill, I don't think they got it. Like the endometrial tissue itself is making its own estrogen, which can be turned into testosterone and all kinds of pathways. And the pill is just blocking ovulation, right? It's just working on that ovary level, right?
But the
So
pill is also just making it so that the ovary isn't doing it. It silences the ovary a little bit. So that's why
yeah,
I think some
or
women
yeah.
do have a symptom shift,
Mhm,
right? Like they're just
mhm.
not, it's kind of like every day the ovary's just not doing that much. So it's not getting this huge estrogen rise,
Right. But
right?
you're still getting that excess estrogen from that tissue, and so it's an incomplete treatment, but I know that. So for me, I had this goal where I was like, "Okay, I should probably take the pill for 5 years because I need to take the pill for 5 years to decrease my odds of getting ovarian cancer," because we had that research at the time, and I couldn't really do it because I just couldn't take the pill. It would made me really sick, but the pill has, I'm not, you and I are not like, don't ever take the pill. It's more just like, are you taking it? It's just kind of masking these symptoms and then you don't know. Because women often like have bleeding before period, mid cycle, heavy bleeding with their menstrual cycle. I mean, it's incredible how often heavy bleeding with menstrual cycle is just like, go put them on the pill. But it's the endometriosis that's causing the problem. And then there's this thing, adenomyosis, in the uterine wall, you can have these pockets of the endometrial tissue and those bleed every month too, but you can't really go into the uterine wall and remove that. So we call it this whole other thing, adenomyosis, but it's literally the same thing. It's just in a different location. So that's another funny thing. Like, why did we even learn it that way and think that it was just like retrograde menstruation? It doesn't make any sense to me. Sometimes we just like learn these things and don't ask, right? But the first guy to discover it was in 1927, actually, was when endometriosis was figured out and it was like a real pathology. And that person didn't ask the questions and just went along the line of like, oh, it's like the tissue somehow from inside the endometrium gets out and starts growing. And then we never kind of went back and questioned it as much. So
So
that's
interesting, huh? Yeah.
it's so 1927. I thought that was like really, really interesting to learn about. But the pain is insane. And I think that this is where women are done wrong, right? Women go to the doctor, they're like, "Oh, take Advil." I'm gonna tell you, Advil was like my best friend at that time. It's the only thing that worked for me. And it's almost like, "Oh, you're like being a little dramatic, like this pain is dramatic." Until I'm like vomiting on the floor. I was just kind of living with this, right? Until I'm literally vomiting on the floor and the dog is like, "Hey lady, you okay? Like, can I do something for you?" Like it was that bad. Like I couldn't move. I was stuck there because I was so it was so painful. And until that point, it's like people are like, "Oh, whatever, maybe you're more sensitive," or and and it's really that like endometriosis creates new nerve fiber. It makes us more sensitive to pain. Like the prostaglandins are just massive in these women. And so I feel like it's part of this, chronic pain hill is such a horrible thing to live in. And then you get the depression and the anxiety and all the stuff that goes with it. But you're going to all these doctors saying, I'm in all this pain. And because the diagnosis isn't so easy, and they just don't, exploratory surgery is like a big step, right? And so,
Yeah, right. I
you
mean, and
know?
yeah, and that I mean, I have a teenager with it. I'm sure of it. And yeah, the OB just won't even touch it. Like they don't want it. They're like, we're not going to diagnose it. Like we're not going to do the steps that it takes to diagnose you. Like manage your pain, go on the pill. Like that is the
Mhm,
treatment, and that she was like, but I want to know, like I want to definitively know.
mhm.
Um, and you know, yeah, it's just really interesting.
And it's important as far as that's, where you and I come together. You had in your early 20s PCOS diagnosis and we're told, oh, you're going to be infertile. And then I had the same thing with the endometriosis diagnosis, oh, you're likely infertile or whatever. And the and that's devastating for women to hear. But the earlier we catch both these issues in women, and it's a lot of women. If 1 in 10 probably have endometriosis, which we've really ramped up that number since we've been doing all these biopsies and more advanced procedures for women. And in PCOS, it used to be maybe 1 in 8. Now it's more like, or it used to be like the 1 in 10. Maybe it's more like 1 in 8. Like if we have these kind of numbers, we're missing so many people. And
We are, and it's just hard medicine. I think a lot of these women end up with going to gastroenterology
Mhm.
and getting diagnosed with IBS, and their OB manages them with a pill. Then they get diagnosed with IBS, and that's it. And so, I mean, I have a couple patients, and it's complex. This is a complex thing to diagnose because
Mm.
women, just because women are minimizing, it's one thing. It's more extreme what you're presenting. That kind of like 2 days home, major throwing up, like that exists. But I'd say most of my patients present much more subtly,
Well,
and
that's because it was trapped in my ovary, just like, and the
right.
ovary was like exploding and getting scar tissue every month kind of thing.
And it's
That's what
hard because when you're assessing a woman, like especially when you're a naturopathic doctor and a woman can have hard, terrible periods just from inflammation alone. It doesn't have to be endometriosis. So like it's like, okay, let's work on your diet. Let's clean up because there's so many toxins that we've talked about a lot in the show that really
Mhm,
drive the estrogen pathways.
mhm.
So many of us that are even doing many visits with patients, like endometriosis is so much longer down on the list unless they look so severe. Because then it's like, okay, let's get the food stuff going on. Weight loss needs to happen. Many of these women, there's like two types of women I find that have toxic estrogen or too much estrogen.
Yeah.
Some are the women that have, most of them are like, many of them are tall and thin like you, tall, thin, and for whatever reason, they make so much bloody estrogen. I can't figure it out. They don't look like an estrogen dominant person. Or the other one is girls that are obese, carrying too much weight, and the fat
Mhm.
cells themselves are driving a ton of estrogen. And it's always interesting to me, these like like tall, very seeming thin, very seemingly healthy, and then have such inflammation.
So
Um,
bad. But the
and I
things
mean,
you're doing are fixing it because you're just the anti-inflammatory daily choices that you're teaching people are the treatments for endometriosis. Do you know what I mean? So it's not that, you have to just continually keep going for surgeries. I mean, I haven't had a
no,
surgery.
definitely not. But you need to be protecting their fertility, which is doing all the anti-inflammatory work
Right,
for
right.
sure. But it's probably important at some point. I mean, the truth is that nobody cares about the ovary really until they're trying to get pregnant. And for most women, they're in their 30s, and by then the endometriosis can be pretty advanced.
And just like in the PCOS, just like we talk about, it's very interesting, our two angles on it, because that degree of inflammation is damaging egg quality, no matter what's causing the inflammation. So we have to deal with the inflammation. But with endometriosis, you also really want to deal with that hormone setup for the extra estrogen, and what's actually happening there is absolutely important to know when you're trying to get pregnant, because it's like you have to treat the immune system and inflammation, or implantation is just not going to happen. I think for us, a lot of times are people who have implantation issues, early miscarriages, those very light positive pregnancy tests. Like, I can remember flipping it and being like, that's a light purple line. That's a light purple line. Endometriosis women have that. That's a common thing. So we
Mhm.
just have to work in that area. And it sometimes comes down to that for us. And it's the first time. And a lot of the people we work with are over 35, and it's the first time anyone's brought up endometriosis or PCOS with them. So it's one of those things that
Do
it's
you
like
see
one.
endometriosis ladies, they tend to be anemic?
Oh, yes, they do. Because
Uh-huh.
we bleed more, it's just a thing. You end up bleeding more. Mhm. And you have more. There's this blood flow thing in Chinese medicine, it's like stagnation, right? Because you have all these inflammation chemicals, and you have this kind of like growth factor, and all those chemical messengers that are part of inflammation cascades can slow down the blood a bit. So that's always that, and that can contribute to pain in Chinese medicine. But it's just continuous pain eventually. It's like once you get those pathways set up with your nervous system, it's horrible.
Mhm.
And so but that's what another thing we should bring that up. Like, we always test the ferritin. Sometimes women are incredible and know that they need to eat iron rich foods, like you crave them. Like, I craved, and I was a vegetarian, which was the worst thing ever for this disease process I was in. Literally the worst thing ever, but it was more ethical reasons. The animals were treated horribly at that time. And so I was so anemic walking around, and so weak from it, that it just drove the whole process even further. So we always test ferritin. And I mean, Hill, what's a good ferritin number? You should share it because it's way different than the range.
50 or 60.
Yeah, and I don't
And
know,
pretty much
what do you think?
anything if anything under 20 is totally you're anemic. And your white blood cells, your red blood cells, and your hemoglobin might not look anemic,
Right.
but anemia, iron deficiency anemia is mostly diagnosed by hematocrit, red blood cells, and hemoglobin, and kind of they all trend light, and MCV. Like, there's many markers. But for many women, those things will be normal, but the first thing that dumps is the ferritin. So you can really catch somebody, but and it's really sometimes complicated. Like, I just had a patient that had a ferritin of 3 and got seen by a whatever, but her red blood cells were high, and it's because the red blood cells are working so hard, the bone marrow is working so hard to pump out, they're just
Mhm.
not good. So sometimes the markers, it's not a very clear story, but if you have a ferritin consistently under 20, and it won't even get flagged, like, if your doctor orders it and it's a 20, they don't even normally say anything.
'Cause it's in range. The range is just
The
silly.
range is enormous. And
Mhm.
then I will say, for other women who have a lot of inflammation, they can still have iron deficiency and iron issues, but the ferritin's high. The ferritin is also a marker of inflammation. It's what we call
Mhm.
an acute phase reactant. So if there's acute inflammation in the body, the ferritin can rise. So you just have to really look at symptoms like what we call blood deficiency, looking pale, pale skin, pale tongue, pale conjunctiva, feeling shortness of breath is a huge one I see. So if I have
Mhm.
women who are like, "Oh God," I'm just like, I can't, I'm like short of breath. It's like right there.
Mhm.
Fatigue, hair falling out, hair dryness. It looks a lot like thyroid. But so iron deficiency anemia that's caused by some of this heavy bleeding definitely goes, these women are getting kind of missed, and just so they're just not feeling great.
Right. It's terrible, and this is another way we don't serve women, because so many people that we look at their lives and we're like, "How did aren't you tired?" And then she'll say, Oh,
My
yeah.
god, I'm exhausted. Who
I
did
know.
we had somebody that we met with, and she had done 5 rounds of IVF, and she's like, "Well, I just was, like, so chronically fatigued, like, I'm just, like, chronically fatigued," and I'm like, "Here we go, this cute lady has done so much IVF and
There's
all
something
all
wrong.
failures, but underneath, it's like, for God's sakes, like, she just doesn't have enough iron," and some people, like, I feel much better if my ferritin is a 60. And
Mhm.
so it takes me a significant amount of iron intake to maintain my level. And I'm not a heavy bleeder. It's just obviously genetic in my absorption. Like I'm clearly not absorbing the iron as well as other people do. So you got to know yourself and know your labs. And it really speaks to me for women. Annual exams are not enough. Like, I really feel like women should be getting blood work at least 2 times a year. I just feel like most women have enough going on that in order to really like work on our fertility, and maybe you don't need that in the 20s, maybe that's overkill, but you turn that corner into 30 and you're not thinking about you haven't had babies yet, you need to be making sure that you're not having inflammation or some of these things.
Mhm. Which you can catch, but often it's in a range that it's not, if you're looking for disease, which is what your primary care and what's happening at your annual, they're not looking for these numbers. So it's really tricky, but it's so important to advocate for yourself and to say there's something wrong with this, like, and really, really, really look closely. But um
And fatigue is a tricky one, right? Like fatigue is a real tricky one. And I'm just going to I never doctor shame. Like it's hard to be a doctor and to catch all the things when a
Mhm.
person comes in and you're trying to unpack their story and figure out who they are by labs and bound so many doctors are bound by insurance companies of what they can order or what they can't
Mhm.
order. But if you have a symptom that's like, if you're looking around, like I have a woman that was just like, "God, I'm just like not like my friends. Like I'm just tired all the
Mhm.
time." Like there is something there. It's not just you,
Right.
right? Like we have to keep trying to uncover
Mhm.
what's going on.
Yeah, and luckily, there's a lot of information for people these days, but the endometriosis I still hear all these things about it that are just completely wrong. People don't understand
Well,
it.
this talk alone's got me thinking I'm going to be calling a couple patients later and say,
Oh,
you know what, let's rethink this
yeah.
because these women, and it's really complex. Like I have a woman who just has pain right here all the time, and I know it's endometriosis, and there's not a
I
damn
have that woman too. It's
I
right
can't
it's
do a
right
damn
there.
thing about
I
it.
have a
It
woman.
hurts her when she has sex. I've gotten her into gastro because there's a big turn that happens right here in the lower right quadrant. It's like where your
Mhm.
ileocecal valve is. So like if you have IBS or something, a lot of times there can be stuff there. We've worked on a ton of stuff. She's lost weight. She presented as PCOS, but
Mhm.
then once they're on the pill, you don't know if they have PCOS or not really because the androgens can correct on labs and they don't have amenorrhea. So it's like harder to say. But she's definitely, I said, you have endometriosis. Like there is no question. And it just stops there because there was like nowhere for her to go.
Mhm.
Like has Kaiser healthcare here. The OB's like put in an IUD and like game over. Like
Mhm.
so we're just going to calm down any of the heavy
Yeah,
duty.
because it's hard to find a really good specialist for endometriosis, but these clinics are popping up everywhere, and sometimes you can go out of state. You want to go to the person who only does the endometriosis surgery all day long every day. One time I went to a surgeon who only does endometriosis surgeries all day every day, trains all the medical students locally to where I live, etc., and they had a fellow with them, and I was like, "Wait, the fellow might be doing part of the surgery?" And I'm a doctor, so I knew enough to say, what side does the fellow stand on? And they were going to be the one on my left ovary side. And I was like, hell no, 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 no. That's not the one who's doing this surgery. So then I had to go to a different specialist because I mean, although the other doctor has done it for eons, I just didn't trust the new fellow who, just I was not going to take that risk with my ovaries. So it's like these questions you have to ask. Or the women who go into the surgeries, and once they open them up, they see, oh, it's up here, it's on the bowel, it's here, it's with the bladder, and then they don't have the GI surgeon ready to go. Like, you really need a center who is doing this very well all day, the best doctors. It's not like you just go to anybody for this kind of surgery, because it can get really complicated once you open someone up. And I've heard, some stories. We've heard some stories from our harder fertility people because of these things that happen. So it's a really complicated surgery that that I think some people get into just because they think they can do it, because some cases are easy, but you really do not want that.
All right, everybody. That was super fun. And Kara knows so much. And
Well, I mean,
this
the
is just
endometriosis thing is very interesting because it crosses all these areas of interest, right? It's like immune system, it's our fertility stuff, it's hormone health, it's a lot of things we're really into, and it's like evolving field, and unbelievable how many people have it.
It is. It's amazing. All right, so let's keep talking. If anybody ever has questions,
Mhm.
please send them along because we would love to support you. And we'll see you soon. Thanks for being with us.